Chronic knee pain is the single most significant barrier to independence for older adults, and the statistics are alarming. Globally, osteoarthritis affects hundreds of millions of people, and it is a leading cause of disability that forces many seniors into a sedentary lifestyle, which only accelerates their decline. If you struggle to stand up from a chair or dread the sight of a staircase, you are facing a critical turning point in your health. Many of you have likely been told that this is simply the price of aging, or that your joints are inevitably wearing out. That perspective is not only outdated, it is medically incorrect and harmful because it discourages the one thing that can actually save your mobility. We are going to discuss a protocol today that challenges the conventional view of joint degeneration, focusing on rebuilding the structural integrity of the knee. Before we proceed to the medical science and the protocol, I want to ask a small favor. Interaction helps this information reach the people who need it most. Please take a moment to leave a comment below telling me your age and which country you are watching from. It is genuinely encouraging to see a global community of seniors taking proactive steps to manage their health, and we make an effort to answer every comment. If you find this information helpful, please like the video and subscribe to the channel if you have not already, so you do not miss future guidance on senior health. To understand why your knees hurt, we must dismantle a pervasive myth. For decades, medicine treated the knee joint like a car tire. The logic was that the more you drove on it, the more the tread wore down until you were left riding on the rim. If that were true, the only solution would be to park the car, or in your case, stop moving. However, human biology does not work like rubber and steel. Your joints are living tissue, more akin to a plant than a car part. A plant requires specific ingredients to survive and regenerate: structural support, flexible soil to allow root growth, and a delivery system for water and nutrients. For your knees, exercise provides all three. It acts as the structural stake supporting the stem, it maintains the flexibility of the surrounding tissue, and most importantly, it drives blood flow, which delivers oxygen and nutrients to the cartilage. This brings us to the concept of motion is lotion. The knee joint is encapsulated in synovial fluid, which acts as a lubricant. When you are sedentary, this fluid becomes viscous and thick, much like honey left in a cold cupboard. This leads to that feeling of stiffness and the creaking sensation many of you feel in the morning. When you move, you warm this fluid, decreasing its viscosity and allowing it to coat the joint surfaces smoothly. This is why rest is often the enemy of arthritis. The phrase "rest is rust" is not just a rhyme. It is a physiological reality. A clinical guideline released in 2024 confirmed that experiencing some discomfort during therapeutic exercise is normal and does not indicate damage. In fact, safe, targeted loading of the joint is the only way to signal your body to repair itself. We are going to move through a series of 5 essential movements designed to target the support system of the knee, starting with the musculature that bears the load so your joints do not have to. The first area we must address is the quadriceps femoris. This large muscle group on the front of your thigh acts as the primary shock absorber for the knee. When the quadriceps are weak, every step you take sends excessive force directly into the bone and cartilage. By strengthening this muscle, we can offload that pressure. We start with an isometric exercise known as the quad set, or quads over roll. You will sit on a flat, firm surface like a bed with your legs extended. Place a rolled towel directly under the painful knee. The objective here is not movement, but activation. You will press the back of your knee firmly down into the towel, attempting to straighten the leg fully. You should feel the large muscle on top of your thigh contract and harden. A common error I see in clinical practice is patients pushing quickly and releasing. That is ineffective. You must sustain this contraction for a full 10 seconds to stimulate the muscle fibers adequately. Perform this for 10 repetitions, 2 to 3 times a day. As you gain strength, you can progress to a straight leg raise, lifting the entire leg off the bed while keeping the knee lock straight. This increases the lever arm and the demand on the muscle, further enhancing stability. While the front of the leg absorbs shock, the back of the leg provides stability and propulsion. This brings us to the second critical component, the posterior chain, specifically the hamstrings and the glutes. These muscles are essential for the mechanics of sitting down and standing up. If they are weak, your knees are forced to buckle inward or shear forward, creating pain. To target this, we utilize a glute bridge. Lie on your back with your knees bent and feet flat on the floor, hip-width apart. By engaging your core and pressing through your heels, you will lift your hips toward the ceiling. The focus here must be on squeezing the gluteal muscles at the top of the movement. This is not about arching your back, which can cause spinal pain. It is about extending the hips. Control the descent slowly. If getting on the floor is difficult, you can modify this by performing a standing hamstring curl, holding onto a solid counter, and bringing your heel toward your buttocks. Both variations work to balance the forces acting on the knee joint. Once we have addressed the muscular support system, we must look at the tolerance of the joint itself. This leads to our third exercise, which is based on research regarding inflammation reduction. It is a static hold, often called a wall sit or low-angle squat. Isometric holds, where the muscle length does not change, are often more tolerated by arthritic joints than repetitive bending. Lean your back against a wall, step your feet out about 2 feet, and slowly slide down. You do not need to descend to a 90-degree angle immediately. Simply slide down to a point where your muscles are engaged, but you are not in sharp pain. Holding this position builds immense strength in the tendons and ligaments without the grinding sensation of movement. Start with a 10-second hold and repeat it 5 times. This inputs a strong stability signal to the knee without the wear and tear of high-repetition squats. We must now address the internal environment of the knee joint itself. While strength is vital for protection, flexibility and lubrication are essential for comfort and range of motion. This leads us to the fourth exercise, which is purely mechanical and designed to combat the rust we discussed earlier. This movement is simple flexion and extension. The goal here is to manually pump the synovial fluid throughout the joint capsule to nourish the cartilage, which has no direct blood supply of its own and relies on movement to receive nutrients. You can do this lying in bed, ideally first thing in the morning before your feet hit the floor, and again at night. Lie flat and gently slide your heel toward your buttocks, bending the knee as far as is comfortable, and then slide it back out to a fully straight position. If you have stiffness that limits your range, you can use a towel wrapped around your foot or shin to gently assist the limb. This is not a strength exercise, it is a maintenance movement. We are trying to reduce the viscosity of the joint fluid. By repeating this 10 to 15 times, you are essentially oiling the hinge before you ask it to bear weight. This simple habit can significantly reduce that sharp, stiff pain many of you experience during your first few steps of the day. Finally, we cannot treat the knee in isolation from the rest of the body. The health of your joints is intrinsically linked to the health of your cardiovascular system. This brings us to the fifth and perhaps most overlooked component, aerobic exercise. Systemic circulation is what brings the healing factors to the tissue we are trying to repair. Furthermore, maintaining a healthy weight through calorie expenditure is the most direct way to reduce the physical load on your knees. For every pound of body weight lost, you relieve 4 pounds of pressure from your knees while walking. The recommendation is to engage in low-impact aerobic activity that elevates your heart rate without hammering the joints. To determine the appropriate intensity, we use a standard medical formula. Take the number 220 and subtract your age. This gives you your estimated maximum heart rate. You should aim to work at approximately 50 to 60% of that number. For example, if you are 60 years old, your maximum is 160, so your target heart rate is roughly 80 to 96 beats per minute. This is a moderate zone. You should be breathing heavier than normal, but still able to speak. The specific activity matters less than the consistency. Stationary biking, swimming, and elliptical machines are excellent because they are closed-chain exercises, meaning your foot stays in contact with the pedal or platform, minimizing impact. Even brisk walking, if your pain allows, is highly effective. Aim for a cumulative total of 150 minutes per week. This can be broken down into 30-minute sessions 5 days a week, or even shorter 10-minute bouts spread throughout the day if your stamina is low. The path to pain-free knees is not about a miracle cure or a quick fix. It is about consistent biological inputs that signal your body to strengthen and repair. By combining muscular strengthening of the quads and posterior chain, isometric loading for joint stability, range of motion exercises for lubrication, and aerobic work for systemic health, you are creating an environment where your knees can thrive rather than degenerate. Remember, the diagnosis of osteoarthritis is not a sentence to immobility. It is a signal that your body requires a change in management strategy. Start with these movements, listen to your body, and understand that consistency beats intensity every time.